Hello, viewers. So today, once again, I'm joined by Dr. Pritha Ghosh, who has successfully appeared in occupational English test on computer. So thing about computer is you take the 3 out of 4 subtests of OET on the same day, and the speaking subtest you can take on a separate day, which you can schedule according to your convenience, and it is delivered via Zoom. It's a video call. So, Dr. Pritha Ghosh, how was your experience with the listening, reading, and writing subtest?
Well, it was okay. Now let's see what happens. I did have some trouble with the part C of the listening. Rest all was okay, I guess.
Okay. So before we start practicing the speaking subtest, I just want to quickly describe the linguistic criteria and the clinical communication criteria. These are the criteria on the basis of which assessment of the speaking subtest is done, and it is done by people who will only get the audio of the speaking subtest. The person you are talking to during the speaking subtest does not assess you. He or she is only the interlocutors. You can speak to this person and they are generally very friendly, but the assessment is by different people, and it is on the basis of linguistic and clinical communication criteria. Let's talk about the linguistic criteria first. So the linguistic criteria is, and for the source we are going to the official occupational English test website, and I think you can see the screen here. Yes, you can see that the linguistic criteria includes 4 things: intelligibility, fluency, appropriateness of language, and resources of grammar and expression. Intelligibility is the one that really makes candidates nervous. It certainly made me nervous because it is explained as whether your accent interferes with the ability of the listener to understand what you're saying. So the moment we hear the word accent, we start thinking which accent should we learn? Should we learn the British accent or the Scottish accent or the American accent, or whether our native accent is going to prove to be a hurdle or not? So don't worry too much about it. It as long as you are understood, your accent should not be a cause for concern. Fluency is where you don't pause for too long and you don't give the impression that you are searching for words, and you also shouldn't speak too fast. If you speak too fast, then you're not understood by the person. And if you pause and search for words, then that is also a bad thing. Appropriateness of language is you choose the right phrases, you express yourself in an appropriate manner. That is, you are not too rude, not too put. Not you have to maintain a professional attitude, but the language has to be appropriate as well. And resources of grammar and expression. This is the part which we tend to ignore the most. This is if you can use idiomatic speech, if you can use idioms while speaking. It is very difficult to uh, get it immediately when you are speaking, so it requires practice. However, don't worry too much about it. If you don't use idioms, it is not a very big problem, at least in my experience. Clinical communication criteria is more or less how we used to communicate during MRCS, how you build the relationship with the patient, you pause to understand what they are saying, you acknowledge their concerns, that is incorporating the patient's perspective, and the question or the communication should be in a structured manner. So you should move from understanding what they are saying to explaining what is required to be done, and you can even tell them that first I will explain what is required, then I'll give you some advice. At the end, if you have any questions, you can ask me. So that structure you can clearly mention before you start communicating, getting into the proper communication. Information gathering is how you obtain the information from the patient in a very polite manner. And when you are giving the information, it should be given in small chunks. So, and you should always check if the patient is understanding what you're saying or not. That's it. Now, it all sounds very simple, and it actually is. The key to do well in speaking is to not be nervous, and it is easier said than done, because just before the exam you can feel a bit nervous because you will be talking to somebody from a different part of the world, and it is okay to be nervous, but that nervousness goes away, that anxiety goes away when you start communicating with them. There is actually a 5 to 10 minute session where you are proving your identity and showing them your passport, your room, all these things to ensure that there is no unfair means are being used. When this communication is happening, what is also happening is you're also becoming familiar with the accent of the interlocutor, and they are also becoming familiar with your accent. So that kind of breaks the ice, and you are able to communicate well. So this is how the scoring is done. Okay, so linguistic criteria are assigned a score of 0 to 6, clinical communication criteria 0 to 3, and you should get at least 350 as per GMC criteria. If you get more than 350, you are safe. I got 430, and we will see if Dr. Pritha gets more than me or not. So without further ado, let's get into the practice. Now for practice, this is how the test is done. You have a role player card, and there is the candidate card. The role player card is with the interlocutor, and the examinee has the candidate card. It basically describes the same scenario but from two different perspectives. So, like the role player card says, the setting is emergency department, where the person is a parent of a 4-year-old boy who has come to the emergency department 2 hours ago after 36 hours of recurrent vomiting and stomach pain. Okay, so this boy has had 36 hours of recurrent vomiting and stomach pain. Now, the doctor has told the parent that the son had viral gastroenteritis. He was kept in for 2 hours on oral rehydration fluids. Now, the son is not present for the discussion with the doctor. So, what should you discuss? These things are also mentioned. And similar corresponding tasks are mentioned on the candidate card. So when you are given this card, you will get two such cards during the exam. When you're given this card, you probably will get, I think, 5 minutes per card or 10 minutes, I'm not sure. But the time will be clearly mentioned, of course. And you get to look at the card throughout the task. So you don't have to memorize the tasks. Don't do that. But when you get to see the task, when you're reading it, if you have any doubts about any word that is used, you can easily ask the interlocutor without any hesitation. You can even ask the interlocutor, do I know the boy? What is the name of the boy? What is the name of the parent? All these questions can be asked, and the interlocutor always is cooperative with these things. So I'll just confirm what is the time for OET, then we'll practice as is. Just go back to the OET website. 20 minutes. Yes, 5 minutes. I was right about this. 5 minutes each for each role play. Although total time is approximately 20 minutes because there are these sessions where you get familiar with the accent, and you also have to prove that you are not pretending to be someone else, that you are the actual candidate by proving your identity with your passport. Okay, so let's start the practice. We'll set a timer of 5 minutes. I'll just do that. Dr. Pritha Ghosh, do you have any questions for me?
Yes, I would like to ask. So, what's the name of the child?
No,
Like
no.
son.
Okay. You can do that. The name of the child is Tim, and my name is John. Yes, Tim. Tim is the name of the child,
And
and
you
my
are the
name is John. I am the father of the child.
mother.
You
Right.
can approach this as somebody. So this is emergency department, so most likely you will not be knowing the child from beforehand or the parent. So it's the first time you are meeting me. Okay. Any other questions, Dr. Pritha?
No, but here it says that he has been observed for 2 hours. So, the doctor has seen him, I know, for 2 hours.
Yes,
The
but
same doctor.
this is the first time. This is the first day we are meeting. You have not known me from beforehand.
Right. Yes.
Okay. It's not like a patient you've seen several times. Like
Yeah.
in
But
a
I know the
in a in a
because I.
community clinic, you will know the patient from beforehand. This is not a
Yes.
community clinic. This is an emergency department. So this is, yes, you have been observing for 2 hours, but before that, you had not met the patient. Okay.
Right.
Any more questions, Dr. Pritha Ghosh?
No, how much time is left? Just let me read this whole thing once.
Okay.
As far as I gave a mock test, and I remember the teacher who was actually helping me with the mock test. She said that we do get a piece of paper where we can take down notes. So is it like, did you keep a piece of
No,
paper with you?
I did not. And I don't
You
understand. I don't know if I'm allowed to. Maybe you can ask the interlocutor on the day of the exam.
all right,
Personally, I don't know what the utility of that piece of paper is. It's just going to add to more information. All the information that you need, it's there in front of
exactly.
you. So that will only act as a distraction, in my opinion. But you can, of course, use it if the interlocutor allows. It is up to the
Right.
discretion of the interlocutor. They are very familiar with the rules. And I don't see the need for a piece of paper because everything is there. If you don't understand a word, so again, another important point is for occupation English test, speaking is specific to the profession. Occupation
Hmm.
English test is a healthcare profession exam. It's an English exam for healthcare professions, not just for doctors, also for dietitians, occupational therapists, nurses, 12 healthcare professions. But for doctors, you have to take the medicine version of the test. And the medicine speaking test, as you can see, medicine is written here on the screen. So you'll get situations where you're playing the role of a doctor. However, even if you get a doctor speaking card, you can still ask for meanings of words if you don't know the meaning. For example, if you don't know the meaning of gastroenteritis, you can
Hmm.
ask the interlocutor, and they may or may not help, but there's no harm in asking. Okay.
Okay. Right.
Are you ready? Okay, so let's start the timer. 5 minutes. Let's start.
Hello, I'm Dr. Pritha, and it's John, right?
Yes, it's John.
So I have been observing your son. I believe it's Tim,
Yes, Tim. That's my son.
4 year old.
Yes.
So I've been observing him, and I would like to tell you that he has been diagnosed with viral gastroenteritis. Do you know what that is, John?
Not really, to be really honest. What is it?
Well, viral gastroenteritis is a kind of infection, viral infection, which happens causing infection of the stomach and intestine. Is that clear, John?
Yes, but I really don't know how he got it.
I understand. Please don't worry. I'll explain everything. So, it can actually spread by coming into contact with vomit or feces of an infected person, or maybe by shaking hands of an infected person, or coming in contact with food or objects of an infected person. Is it clear, John?
Hmm. Yeah, but he looks so weak.
I
Oh,
can understand. Well, he was having some dehydration. So, we did give him oral rehydration therapy, and now he is fine. And I would like to tell you that he's ready to go home. Do you have any concerns in particular, John?
don't you think it'll be better for him to remain in the hospital?
Yes, I can understand your concern, but let me reassure you that in such cases, as his dehydration was very light, so as he's able to accept oral feed, we have given him oral rehydration, and in such cases, oral rehydration therapy usually is effective. Is that okay?
Yes, but what if he starts to feel worse at home? I'm really worried about that.
Yes, I can understand your concern, but don't worry. I'm going to tell you what you have to keep in mind and what are the symptoms that you have to keep in mind when you have to come back to the hospital. All right.
Yes.
So I would like to tell you that you can give him unsweetened fruit juice. You can give him electrolyte drinks. All right. And just in case if you see that he's very thirsty or he's feeling very weak or he's irritable or you see that he's becoming pale or his eyes are sunken, in such cases, you might have to bring him back to the emergency. Is that clear, John?
Hmm. Yes, you've explained it quite well. So there are situations when I might have to bring him back to the emergency.
Yes. Yes. Is there anything else that you're concerned about, John?
No, no, you've explained it quite well. So I understand what I should do what I should do to, and when I should bring him back to the emergency.
All right. So I'll just sum up everything for you. So he has been diagnosed with viral gastroenteritis, which is an infection of the stomach and intestine. You just have to take care of his hydration level. You please do not give him sweetened fruit juice, and you have to give him electrolyte drinks. And just take care of his hydration and keep in check of the signs of dehydration, which I've already explained. Is that okay?
Yeah, sounds good.
All right. Thank you so much. It was great talking to you.
Yeah. Thank you, doctor. So we can stop the clock here
How
and
much is it?
1 minute 19 seconds. So
Oh
usually
God.
what happens in the exam is you have to go on speaking for five
Right.
minutes. Okay.
Mm-hmm.
If you finish before 5 minutes, it is generally believed to be something where you have hurried too much or you've missed out on any point. Although you haven't, in my opinion, missed out on any point. But ideally, you should be able to use all 5 minutes of it. And usually the interlocutor fills up the conversation in a much better way than I did. So you will be able to reach the 5 minute mark. However, if you reach the 5 minute mark and you haven't finished everything, but you have got into the let me summarize part, then you are pretty much safe. The only feedback I can say is you could have structured the conversation. Like you could have mentioned before getting into the details that, okay, so first I will explain to you about what the disease is and the condition of your son and whether you can take him back home or not and what are the precautions you need to observe when you take your son home. So that structure, if you could provide, then it will be perfect. Otherwise, it's pretty good.
All right.
I don't think there's any issue with this. So, do you want to practice one more?
Yes, I can do that if you have time.
I have time. But I
Wait,
don't know how to
put
find.
that
Okay, I'll just look for it.
speaking.
Um,
Which one you want to do? Sample test
three,
three or
three, three, three. This is listening. We have to go to reading. Oh, sorry, speaking. Yeah, this is
speak?
speaking. Speaking. Why can't I go this? Learn more. Okay. Oh, it is speaking. So, as you can see, there are specialty specific speaking tasks, dentistry, dietetics. I'll just pause for some time. So we practice sample test 4. Let's practice sample test 5. Okay.
5 नहीं तो. Okay.
5 we've done.
No, we've not. But you said three. Okay, I'll open five then. Wait.
Let's do 5.
Yeah. Okay, let's do five.
So again, we'll just, there's no need to repeat the whole thing. This is the role player card with which the interlocutor will have in front of on their screen, and the exam and the candidate card will be with the candidate, that is the examinee. So this is the setting. The setting here is medical clinic. There is an 86-year-old patient who attends regular chair exercise classes as you have difficulty walking and use a walking frame. So the interlocutor is the patient. The patient is concerned about their lower back as they felt some discomfort on waking up this morning. And then you have 5 different tasks and corresponding versions of it will be there for the candidate also. So once you're done reading and if you have any questions you can ask, then I'll start the 5 minute timer.
Right.
Mhm.
Right, we can start.
Okay, let's start.
Hello, I'm Dr. Pritha. Could you please confirm your name for me?
Yes, my name is John Smith and I'm 86 years old. Hello, Dr. Pritha.
Hello, Mr. John. Is it okay if I call you John?
Yes,
All right, Mr. John. I see that you're having some problem with your back. Could you tell me more about it?
yes. So when I got out of bed this morning, I noticed
Mm-hmm,
some discomfort in my back. So I'm really
mm-hmm.
concerned I might have damaged it.
Well, I do understand your worries. So could you tell me more about it as to why it might have happened? Like exactly where it's hurting, or is it painful?
It's there isn't really any pain. The problem seems to be in my lower back. It's more of
Mm-hmm.
discomfort than pain. Um,
I understand. All right. And could you tell me if they did you enjoy yourself somehow, or was there some kind of overdoing of any exercise, maybe?
um, yes, now that you mention it, I've not had any injuries, but I do go to these chair exercise classes. I go to them regularly. I went to them yesterday as well. Nothing happened during the class, but when I got out of bed this morning, I am noticing this discomfort in my lower back.
Well, I can understand that could be a cause of this discomfort that you're feeling. I guess it is most probably some kind of a back strain, which is of mild degree. It happens mostly because of overstretching of the muscles or ligaments. But do not worry, it is not going to be of any concern. But to know exactly why that is happening, I might have to do some examination. Is that okay, Mr. John?
Yeah, that's all right. But will I be missing classes?
Yes, I would have to advise you to take off from exercise for about a week because if you do not take off, then exercising might cause more pain, and then ignoring the pain is not really good.
But there isn't any real pain. Is it really necessary to miss the classes?
Yes, I do understand your concern, but I would like to insist that please take an off from the class for about a week because if we do not prevent this injury any further, then it could lead to something more serious and it will take even more time to heal. Are you
Mm.
understanding, Mr. Thorn?
Yes, I understand, but now I'm wondering if the classes are right for me.
Well, I do understand your concern. As you are using a walking frame, it is very important that you have to keep your posture improved. And to do that, you have to keep your strength intact. So this will help in boosting the energy. It will also help improve your mood, and it does help with social interaction, right?
So you're telling me not to give it up completely.
Yes, I'm asking you to take off for about a week so that this pain or discomfort that you have settles down.
Mhm. I'll follow that advice.
All right. So I would also advise you to use a heat pack twice a day. And I will also be giving you some pain medicines to use in the meantime. All right.
Hmm. Thank you, doctor.
But I would also insist that please do not overdo any kind of exercises because I am sure you have been doing this exercise for quite some time. So you have to know your own limits, right? Because overdoing can cause more damage than any good.
Yes, that makes sense.
So is there anything else that you would like to ask or any particular concern?
No, you've explained it quite well. So what do we do now?
Yes, so I will be doing a physical examination. Do I have your consent for that?
Yes, why not? Go ahead.
Right. So I will just summarize. My diagnosis here is most likely that you have a mild back strain. It might have happened because of overstretching of the muscles or ligaments. You will have to take a week's off from the exercise. And once you resume the exercise, please do not overdo any exercise, right?
Okay.
All right, Mr. John, let's proceed to the examination room so that I can do the examination, right?
Yes, let's start the examination. Okay, so that was quite good. You still have 20 seconds left. I'm sure the interlocutor will fill that time up more effectively. But again, the same feedback, you can always provide a structure before you actually get into the task. So once you
All
have
right.
found out the cause of the visit, that discomfort in the back, So I'll first
This
tell you what. Go ahead.
Okay. So you're trying to tell me that I will have to explain it to the patient, that I'm going to tell you what might have
Yes.
happened.
Yeah.
Okay. Okay.
You can tell the patient about the
I thought you're
structure.
talking about presentation, I think. All
Tell
right, I got
about the entire you can structure the entire communication and tell the structure also. That now that
okay.
I found out what your concern is, most likely first I will tell you about the most likely cause, then I will tell you about the precautions or the most like why this happened, whatever is the task. you you can tell those things, that this is how the discussion is going to proceed. At any stage, if you have any questions, you can ask me. So this
Right.
gives, so not only have you asked the question in a structured manner, you've also told the patient that this is how the communication will happen. So that is, I think, helpful. Okay, otherwise it's quite good. I don't think there was any mistake. So, Dr. Pritha Ghosh, when is your OET speaking? Is it soon?
Yeah, it's next week only.
Okay, so I think the next video we'll have is you talking about your success in occupational English test. Okay.
Let's just see what's happening. Fingers crossed.
Okay. Thank you so much for participating in this speaking session, and I hope the viewers enjoyed it as well. So if you have any questions, let me know. I'll get back to you as soon as possible. Thank you, Dr. Prisa
Right.
Ghosh, once again. Bye bye.
So,
And thank you, viewers, for watching this video. Hello, are you there? Are you there or not? You left. Okay.